Perfect. Thank you, Jade. And we will first have a panel discussion among the panelists, and we'll then open up the discussion to the audience for a Q&A. So feel free to ask your questions in the chat at any time, also during the panel. And afterwards, we will make sure that in the Q&A, your question will be answered. I would like to tell you about Digital Switzerland. We are a Swiss-wide cross-sector initiative that aims to strengthen and transform Switzerland into a leading digital nation. And our mission is really to coordinate and facilitate the process of digital transformation of Switzerland and to help Switzerland become a leading and fertile breeding ground for digital innovation. We're member-based with over 170 members and partners that collaborate with us on different projects and Swiss-wide initiatives in different areas such as education, e-sustainability, digital health, artificial intelligence, to just name a few. The aim of the digital health program is to digitalize the Swiss healthcare system and make it patient-centric. And we have different projects in the program. One of the projects is the Swiss Patient Journey Ecosystem Map. And this map illustrates all the different digital solutions in Switzerland that focus on the patient journey and the healthcare system. And this map really helps to better understand the complexity of the Swiss ecosystem. And the goal is really to help find synergies and really foster collaboration between the organizations. We update this map regularly. Next update is planned around July this year. And we create different categories. We've already had 2 webinars on 2 of the categories. One was data interoperability, the other was healthcare interactions. And today we will look at health monitoring, the third of 5 categories. And before we now really delve into introducing the panelists, we would quickly want to know from you who is actually joining this webinar, which sector do you work in? So shortly scan the QR code, or you can also go on menti.com and use the code so we see who's joining today. Jade, how is it looking from the answers? Should I stop sharing the screen already, or?
Yes, it's starting to pop up. So I will be just quickly showing my screen so we can kind of see live a bit the answers. Perfect. So I will present. Can everyone start to see? So we can we start to see a bit the different feedback. So we see a lot of people are coming mostly from the healthcare sector, but also a bit in different environment, but also from service providers or security activities. So quite a diverse group, but with a strong focus on the health sector, which makes sense due to the topic. Perfect. We can also maybe have a quick look at the end once more feedback will have come up. But I'll give you back the floor, Cecile.
So let me reshare my screen. Perfect. So I'm now happy to introduce our today's panelists. We have Willemien van den Toorn. She's founder and co-CEO of Evismo. Then we have Guillaume DuPasquier. He's co-founder and CEO of Domo.health. And last but not least, we have Esmeralda Megally, co-founder and CEO of xsensio. Welcome, and also thank you for being available for this webinar over lunchtime. I would like to pass over to you and let you panelists introduce yourselves and your solution. And I will share the one slide that all of you have sent me, so you can present your solution. Let's start with Willemien.
Thank you, and hello everybody. Good morning, afternoon, whatever, lunchtime. As introduced, yes, my name is Willemien. I'm one of the two co-founders of evismo, which we founded in 2018. We've been active on the market since 2019, really, with patients and customers. And what we offer is a B2B platform which offers diagnostics as a service for multiple diagnostics. We seamlessly connect the stakeholders, which really enables us to moving away from moving patients to just moving the data. We have a system which is set up in such a way that the medical professionals can work with their preferred network, with their partners, with their referrals, referring doctors, or with the partners that we provide if there's not enough partners in the area. And that makes our entire service very easily accessible to both the doctors, but also the patients, of course. Our first service that we have in the market is CardioFlex, a long-term ECG service, which is for patients with cardiac arrhythmias. And by bringing this as early as possible into the patient journey, we can provide better outcomes because we give better and reduced time to therapy, which leads to fewer complications, and in the end, for all of us, lower costs. And by having a digitalized solution in the market, we have up to an 8-fold better offering and better diagnostic yield, which also here leads to a lot higher satisfaction in patients and to better treatment within a short time. We have 18,000 patients covered so far. With our CardioFlex service, we're adding other diagnostic services as we speak, both for sleep apnea and stress and burnout diagnostics to general practitioners, but also specialists, stroke centers, hospitals.
I thought she had an accident.
Sorry?
I think
somebody was on yeah, but that's what evismo does. This is how we've been active in the market since 2019, and CardioFlex is our flagship product, but we have other diagnostics in the market already as well.
Thank you, Willemien, sorry. Let's move on to domo.health. Guillaume?
Thank you. Hello, everyone. So I'm the CEO of domo.health. We've created a company around 10 years ago, first with the mission to help more the elderly population to stay home longer, and then tackling disease area like Parkinson, Alzheimer. So we are active in this kind of digital health industry since 10 years, trying to collect data from home, which would make sense to have more kind of a preventive or predictive approach, and then to share data to the healthcare professional. The challenge was how those data can be used in their daily clinical routine, both of home care organization and clinics. That's why in 2022, we took the decision to develop our own home care platform, which means that we have a patient app facing the patients. They can record what they do, see their health data, as well as a platform for the professional, first targeting the home care organizations, as well as hospital at home project. And this application or these solutions enables to have a view in one dashboard about all of the clinical data which is surrounding the patient, which include clinical observation, data coming from medical device, external EHR solutions. And this is now, that's been launched end of last year as a Spitex or home care tool, where the nurse can also invoice their time electronically to insurance company, as well as doing their planning, invoicing, and so on. So it's now sold as a license, yearly license to home care organization using the software. And we have now a rapid adoption of those technology because we are not only having those invoicing solutions, but we also combine data that we collect from home for specific disease areas, as I was a bit talking before, like for Parkinson's patient, we collect sleep, or for respiration, we also collect, for BPCO, we also collect heart rate. This is not things that we do ourselves, but we integrate other sources of data longitudinally in real time. And that's why we use some AI technology to do some triage and help the physicians to make the right decision at the right moment. Voilà. Thank you.
Thank you, Guillaume. Very interesting solutions, both of you already. And now we hear from Esmeralda. What does xsensio do?
Thank you, Cécile, and glad to be here with all of you today and share our perspective. So xsensio is a company, I'm the CEO and co-founder of xsensio. We are based at EPFL. And what we're doing, we're developing what we call a lab on skin platform. So we're developing a new generation of wearable devices that track not what we've heard from Willemien and Guillaume about the parameters, but we're tracking different kinds of parameters, which are biochemical data. And so we're developing sensing technologies that are able to capture information directly on the body of patients, information that would typically be tracked in a lab test. So we're bringing dynamic data to the biochemical world of information. So you could see here, the solution is a hardware, which is minimally invasive. It's a device that is actually put on the skin as an adhesive, and it's minimally invasive with very small microneedles. And what it does is it captures in real time continuously information in a biofluid just below the skin, and then provides this information in real time to the doctor. You could see here, there is the first application, we're focused on the hospital setting. And what we're doing is we are tracking critical care parameters directly on patients, parameters that are some of the most important ones. Yes. And we are providing this information so that we are able to tell doctors and nurses when a patient starts to be unwell, because, for example, lactate has changed. And lactate today is done with a blood test throughout the day, or maybe once or twice a day, and is the single most important biomarker of shock. And when it's not captured frequently enough, then the patient can evolve very rapidly from shock to septic shock to organ dysfunction, and then 1 out of 2 patients dies. So the first application is around critical care, but we're also working on a pipeline with other big hospitals on some other biomarkers that are good for heart failure, for example, for the home use, and also monitoring for patients that have cancer, and being able to detect when there is an increase in inflammation, potentially as an adverse effect of treatment. So setting is one single platform that is very modular, depending on what type of biomarker we want to track. And it's for 3 different settings: the hospital, outpatient setting, and then home care. That's it. Looking forward to the discussion afterwards.
Thank you, Esmeralda. Let me stop sharing the screen. So actually, it was interesting to also hear from you, Esmeralda, the fact that you have real-time continuous monitoring of the relevant health and wellness parameters, right? And one thing that would be interesting to know is, for the patient, him or herself, how do you make sure that they understand all these parameters and health data to actually make better health decisions?
So that's an interesting question. So the first primary application is for the doctors to be able to see. So we're bringing dynamic information when today they have been using static information. So they're typically taking a blood test, then after some time they look at it, they make a decision to do something or not to do something, and then they act upon it, and then a few hours later there is another test. What we're doing, we're taking the same biomarkers for the first application and we're automating that to give warning signs. We want to empower the patient, and we want to empower the patient at home or outpatient setting to be able to actually go into much more preventive health. So what we're doing is we're capturing this information in real time and then providing thresholds when something is starting to be not really as normal patterns. So we're identifying patterns, normal patterns with abnormal ones, and then we're digesting this information for the patient, because the patient is not actually, we don't want to overwhelm the patient with information and data, just data. So what we're doing is we'll digest this information and tell the patient to go and see the doctor when the patient is at home. And then to be able to allow the patient to know that something is happening and be much more into preventive health and not wait for escalation. Because we know, for example, for shock, that very often the patient is at home, there's an escalation, and it's only very late that the patient goes to the hospital. And that brings a lot of extra healthcare costs, a lot of comorbidity for the patient, overcrowding of the healthcare infrastructure. So if we want to be able to go into more preventive and predictive health, then providing the information at the onset of changes is what we believe something that could really impact the healthcare system.
Mm-hmm. That's very interesting. And in a way, I think the whole preventative health and predictive health aspect is also covered by the other two panelist solution. So Guillaume, it would be interesting to hear when you were showing your solution, how is your solution different from other platforms when it comes to the patient journey?
Yeah, so in our approach, we are trying to understand the different interaction, not only on the hospital side or at the home side, because as of today, there's a lot of silo, maybe as you know, in the healthcare industry. You have silo with home care, with different software in the hospital. And sometimes the primary care is not that much collaborating with the secondary care. Also the coordination around the patients, the gatekeeper as being the GP for normal health issues. When you talk about chronic condition, it's about following up more complex diseases with lack of resources, and then the coordination is a bit more made by the doctor, the physicians of the hospital, which is also doing a bit the coordination. And what we are trying to achieve is just connect those two worlds together with a single platform and making integration within those two worlds. That's one. So making this coordination and collaboration smoother. And in addition to that is also to use real-time longitudinal data, as I was a bit saying, because the whole health is about photographing time. You go to hospital, we do a diagnostic and treatment, you go back home, and then you don't know what's happening between two visits. And by bringing more data that are collected from home is enabling them to have a better personalization of the treatments, as well as also to include more the patient in the journey, also what the patient, kind of an actor of the healthcare, and also to collect data from how did they sleep, what did they do, and so on. So then we have a lot of kind of projects also on the research side, not only on the business side, with university hospital around here, where we try with the doctor to identify which are the parameters that would make sense that we should look at home, like the evolution of the sleep quality, typically when you have Alzheimer or Parkinson's disease, and then to co-develop kind of predictive analytics or predictive risk assessments, then to help the physicians, but the home care organization then to make the decision about, shall I do something now or shall I wait? Yeah.
Mm-hmm. Mm-hmm. Yeah. Also, the whole collection of data is also covered by the CardioFlex solution from
Yeah.
And Willemien, so your flagship project that you introduced before, all the collected data. How do you leverage this collected data? And how do you make sure that the healthcare professionals actually have access to all the data that they need to monitor the patients?
Mm-hmm. I'd say maybe to take one step quickly back to also the question you asked, Esmeralda, how do you make sure patients understand the data? I think that's a very important question that we have the same approach as well, that we really have decided clearly we are a B2B solution. It needs to be very easily accessible to the general practitioners and to the specialists and to the doctors who work with the system. Of course, for patients, it should be easy to use. It should also be easily accessible, but understanding the data and understanding the implications of the diagnostics and knowing what to do is not something that patients automatically do. And we really believe that taking the patient by the hand through the doctors with this information is extremely important. And that's why we don't make a lot of our data available to the patients to see while they're taking an ECG. Because as a patient, you don't, you see a heart beating and you see it jumping, but it doesn't help you. But we have it available on our platform, on the one hand, for the nurses already during the measurement, so they can see if the data quality is good, but they don't, get to analyze it because that's cardiologists who do the analytics. But the data is also almost real-time available to the analyzing cardiologists or the analyzing specialists. It's all a web-based solution. So in that sense, and the way we've set up all the processes, it can be continuously monitored and checked. We offer certain daily checks that we do both on the technical data, on the technical data quality, as well as looking on a medical perspective, whether we find what is being looked for. And because it's web-based, everybody who needs to have access can access that data continuously. The patient is informed through an app very easily that the measurement is ongoing or ended. But by having that online solution and all the relevant players involved, we have a solution where really the data is moved, the patients just go to their main contact person, the doctor, who leads them through the full process. And I think that's an important question to also ask in any digital health setup we do. What is needed for the patient and what is really needed for the practitioners? Because we can't overwhelm our patients with all this new information that they don't know what to do with and what to handle with. And we need to give the doctors the tools to really know, the tools and the guidance to really know how to handle the cases in a fast and easy way.
Yeah, absolutely. And also maybe vulgarizing some things, so making them easier understandable for the patients and not talking in jargon. Yeah,
that, and I think also giving, having the patients the information available to all doctors who need it. So we now have a closed system. We did the long-term ECG and now it's in our system. We need to make it available for the further treatment. We need to make it available also when the patient needs to move from one doctor to the next. The raw data needs to be available to everybody. Otherwise, we continue to do too many measurements on these patients who already have clear data.
Mm-hmm, mm-hmm. So we now discussed patient empowerment, also knowing who uses the data and having the information needed. I would like to take a step back. Guillaume, before you also quickly mentioned the fact that a lot of things in the Swiss healthcare system are still very much siloed. Maybe can you tell us about what are the hurdles, or what were the hurdles when you introduced your solution in the Swiss healthcare system?
When we work with them
We can't hear you that well.
You can hear me well?
Now, yeah, now it's fine again.
Okay, sorry, yeah. No, when we sell our solutions to home care organizations, the biggest challenge is obviously the change management. Sometimes they use still paperwork or other software of the market. You have to copy paste the whole data set that they already entered into other system into our. So that I would say that's one of the challenge, change management on one side. But what we see that as we have a rapid adoption because we have UX solutions that are a bit better than competition, I would say. That's why the switch is a bit okay. I would say you have to convince the top managements to make the change. But then I would say the challenge is when we talked about the silos, obviously on the hospital at home project is about interoperability with other software. That's one. As you know, about the hospital, there are 4, 5 or 6 big players like Epic, eSIM, and others in Switzerland. In the home care, the software are like Nexus, Perigon, or Medlink. So that is how do we make integration with those software? And also, obviously, there is this cantonal issue where each of the cantons have a different way of reimbursement for the like the TARMED or the OPAS, so the ordonnance sur les soins à domicile, so the catalog of the home care services in Switzerland, and and the reimbursement that each canton has, which are a bit different. Sometimes they reimburse 5 minutes or 10 minutes or 15 minutes. And then the software needs also to tackle all those small use case of each canton, which also make for us kind of important developments, even if it's not difficult to do, but we have them to follow all of the different regulations per canton. And also one big issue in Switzerland is the fact that there is not a unique identifier for patients as well as for doctor. Also the electronic signature, as you know, maybe in SHUV, they're still signing document by hand and sending by email and so on. So I mean, there is solutions like HIN, but still we are lacking a bit of a centralization in the healthcare industry, like we have in other countries like France.
Mm-hmm. Absolutely, yeah. To Willemien or Esmeralda, what do you want to add to what your hurdles were or are in connecting this your solution to the whole Swiss health ecosystem?
I can jump in. So I think we're a bit more early stage than Guillaume and Willemien in our case. So we're developing new technology, and so there is definitely finding champions, which is great in Switzerland. So there is a lot of interest for new technologies. But I think one of the challenges, as Guillaume mentioned, is change management. So in a hospital, or there is already a workflow, how to change that workflow. When already things are really going very well in Switzerland, we have a very good healthcare system. Why change? Why be more into preventive health? If we're already capturing enough information and capturing information in a relatively early way compared to other countries where things are a bit more reactive because there is not enough resources. There is a sort of, Switzerland is investing a lot in healthcare system. I think it's a very high percentage of the GDP. It's not a sustainable, I think it's maybe 8 billion that is invested every year is not really there. I think there is this realization that is not going to be sustainable for the next decades. So there is I think probably at the hospital levels or the management levels, an understanding that things have to be changed. But the challenge, I think, is making sure that everybody around the workflow would adopt a new technology and change what they are doing to care better for the patients when things are already performing well enough. So I would say that's probably a challenge that we see in Switzerland because we have a great healthcare system.
Yeah, I'd agree. Besides change management in the processes, I would expand it to also the change management of the mind, or the mindset change. When I've learned something at university, and we have that very strongly with our long-term ECG, in everybody's mind, a long-term ECG, long is 24 hours. Everybody knows that the diagnostic yield is extremely low. By just prolonging it to 7 days, you know, we have a much higher diagnostic yield, but because we invested in devices in the healthcare system, and we've learned that 24 hours is what we can do, because this was in the past technically the best we could do. It really takes a lot of time to change that mindset in order to then be able to change the processes. And in order to do that, what I find one of the highest hurdles is getting the face time of the responsibles and the deciders, because everybody in the healthcare system is so busy. But in order to bring our product to the healthcare professionals, we need this face time. You need the time to show them and to convince them. And that, with the limited resources we have, is a huge hurdle to get into as more and more customers. And then the whole, I guess, demanding regulatory environment between the EU and Switzerland, I would add to one of the hurdles that we make ourselves. We make lives, besides what Guillaume was saying, this cantonal thing, everything's different per canton, but then also we're in Switzerland with different and difficult rules. Those are hurdles, especially for a young company, are really painful to overcome.
I'm not sure we've mentioned reimbursement, but also that's maybe for a different conversation, but it's also digital health reimbursement is also, I would say, a challenge. It's not extremely clear. There is still a lot of ambiguity.
Esmeralda, maybe, so in a way we can almost rephrase this as what would your wish for the Swiss healthcare system in the future be? That the reimbursement issue is solved or is developed further? But maybe a more open question, what is your vision for the Swiss healthcare system?
I would say realizing that digital tools can simplify a lot of things. They have to be very well established and very well understood and analyzed, and it has to be very good quality. But I think making a bit of sort of embracing this digital transformation at all levels for the benefit of the patient, so that the patient doesn't have to be, to go on very often what we're trying to simplify is also detecting things at home instead of bringing every time, let's say during a certain treatment, the patient back at the hospital. So if we can digitalize this, if we can digitalize the conversation between the patient and the doctor, there is a lot of benefits for all the different stakeholders. So I would say embracing that transformation and allowing reimbursement to be simplified for that would be, I think, a great pathway if we want to make the healthcare system much more sustainable for the future.
Thank you. Guillaume, what is your vision for the Swiss healthcare system in 2050?
Well,
we don't hear you, Guillaume.
no, it's okay.
I think now it's better, yes.
Yeah, so yeah, I don't know why when I switch to anyway. So no, I hope that we will be more in an integrative care world in Switzerland, and that there will be more adoption of new innovation by the public sector as well as working with the private sector, and have more hospital really working end-to-end with innovator like us to bring new solutions on the market. To have this adoption, so obviously having also a more framework of reimbursement, the one that is already in place in France or in Germany with DIGA. There's a lot of things that we can learn from those other countries, and there are already a lot of different solutions which are saving cost in the US or in Europe. It's just a question of now somehow of copy paste. So it's not anymore an issue of technology, I think, and I hope that people can just embrace more faster this evolution.
Willemien, embracing the evolution faster. What is your vision for the healthcare system?
Yeah, I think a lot of it has been mentioned. I believe digitalizing the processes where we don't move the patients but move the data. We have it continuously or more. We don't need everything continuously, but we have more data on a more regular basis without every time bringing the patient in is where we need to go. We need standardized remuneration. What we have today with hospital and outpatient and inpatient and whatever makes it very, very difficult. But I also hear always saying, you know, I think we need also as startups to rethink. We need to stop thinking that everything new can be paid also out of pocket. I really believe our healthcare system is already very expensive, and we can't, everything new can't be in addition to what we have in the reimbursement system. So we need to start rethinking also when we bring new solutions to the market, how does it fit into the current reimbursement system? Because we can't wait till we get it reimbursed, because by then, you know, mostly we don't survive. But that's the way we really constructed our services, in a way that how can they fit into the current reimbursement system in order to be able to be offered to patients as quickly as possible. And more holistic. We're still very much in the silo thinking. Every doctor thinks in his little patient encounter, and we need to become a lot more holistic in the way we approach patients. And that can only happen by becoming more digital and more open with the data we have.
Thank you for this outlook, this forward looking outlook. I would like to now open up the discussion. There are a lot of discussions ongoing in the chat. So I hand over to Jade for this Q&A part. And if anyone has a question, you can also raise your hand and ask your questions directly.
Exactly. So thank you very much. I've seen a lot of traction on the chat. One question I thought I would start, while people can start also raising their hand if they want to express themselves directly, would be the question around the different business models, and how is your solution exactly inserted into the whole health journey of the patient? We did talk a bit about reimbursement and the hurdles you're facing. Currently, how are your solutions being paid for? So is the service being reimbursed already? Is it now more, as you're saying, you're mostly B2B? Is it then the hospitals paying you? So maybe you can, each of you, just share a bit of light regarding, how is your solution being paid? And also is your solution inserted in the patient journey? I don't know who wants to go first.
I just mentioned it already, so maybe I go first. I can keep it short. We're fully reimbursed. Our services are fully reimbursed, because we looked at, before launching it on the market, we looked at how is this diagnostic solution currently solved? How is it reimbursed? And how can we design our service that it fits the requirements? Because we strongly believe we are doing more for patients. We are increasing the diagnostic yield, but we need to offer more for the same amount that we get in the reimbursement. But I think for us, it has paid off to structure it in this way. While launching it fully reimbursed, we have then been talking to the doctors' societies, and actually at the end of 2022, there was even a new recommendation by the Swiss Society of Cardiology that even enforces the payment of our service. So by going in with the existing and then adding on, we've been very successful and happy with moving it into the existing system.
Perfect. Thank you very much. I don't know, Guillaume, Esmeralda, someone wants to add upon it?
No, so on our side, as the nurse, they use our tool as their daily tool to do their planning and invoicing to insurance company. We just they pay us a kind of a subscription per month between 50 Swiss francs and 100 per month, representing around 600 to 1,000. So when we work in B2B with one home care of 100 nurse, then we pay 100 times 1,000 per year to use our software. So there is no reimbursement at this stage. When we tackle specific this area to do more service monitoring, We also work with the pharmaceutical companies that are willing to get real-world evidence or real-world data. So they finance us clinical studies to collect data and to see how the drug is evolving in time. So that's our second way of how we do money. And there is also a third one, which is also bringing more clinical evidence to like the French area, because we also have an office in France to get some reimbursement. And maybe there was a question about how we could work all together with the company that we are talking today. With Evismo, we already had some discussion with some doctor, because Evismo could be integrating within our solution as a diagnostic tool that we can integrate, making a diagnostic, and the output of the diagnostic could be then integrated with our solution. And then when we put in place a treatment, then there will be the monitoring with other tools. But we already have discussion with Evismo or other companies in this area doing diagnostic. And with Esmeralda, I'm not sure if she already got the medical device certification, I'm not sure. But when she will get it, obviously that's a sources of information that is really interesting for us to integrate as well.
Yes, yes, definitely. I mean, there is synergies possible here. So we are pre-commercial in our case, and the goal is to have, of course, the product reimbursed in the future, but in the meantime, hospitals actually paying for this, because this, we believe, will reduce. We're in discussion. We have the Mayo Clinic as a shareholder of the company, and we have collaboration with different hospitals, and they see this as a way of reducing risk as the whole industry is moving towards value-based healthcare, where hospitals are going to be penalized when the patient goes back home and comes back too quickly. So a way of mitigating risk internally, reducing costs, reducing overcrowding of ICU. So all this, we believe, is in the best interest of hospitals. So, yeah.
Perfect. Thank you very much. And also thank you, Guillaume, for already kind of touching upon the question, because a lot of people were also writing in the chat about the fact that there's all these different solutions. Every new digital health solution, as we were also saying before, has their own app. And how is it going to be kind of in the future? We can't really expect healthcare professionals or patients to have 1,000 different apps doing 1,000 different things. So really happy to see that there's already collaboration starting to happen between the different actors. One follow-up question, Esmeralda, you're saying that Mayo Clinic is one of the main shareholders of your company. So are you at the moment mostly focusing then on the American market, or are you also then on the Swiss market, just out of curiosity?
So the Mayo Clinic is a small shareholder. It's not
okay, sorry.
No, but so we're also have collaborations in Switzerland with Swiss hospitals as well. So we are focusing, because for development purposes, it's easier to work in Switzerland. We see the US market obviously as a huge market for us, but Switzerland is where we start for now.
Okay, perfect. Thank you for clarifying. There's also some questions regarding how you kind of, because you're all rather, as startups, you're often quite limited with resources. So how are you kind of, I see Guillaume has started answering, but how have you kind of started collaborating maybe with other stakeholders, maybe from bigger companies or so forth, to really try to go closer to the healthcare professionals for most of you, or then the patients? So what's kind of your strategy there regarding partnerships and collaboration? Maybe we can ask Willemien to start, because I saw Guillaume already started answering on the chat, but...
Yeah, happy to answer. Very early on, we started working with partners, because yes, you're two people and you want to win everybody over for your solution. So we started on various levels, because we were reimbursed, and we developed the service to be reimbursed. We didn't go that much into the health insurances, which is often the first step. But we started to talk to networks. So very early on, like Argomed, which is the biggest general practitioner network in Switzerland, they caught on and they helped us promote the service within their network. Or we have Medbase. We have a contract with Medbase, which is also a big network of general practitioners and pharmacies in the meantime, where they promote the service. But we've also started partnering with one of the pharma companies, who, of course, they have a huge sales force out in the field. And they now support our sales efforts because they're close to the customers. They have medication and treatment that helps patients who get a diagnosis from us. So for them, it's also an added value. So we've really looked at the full scope of partnerships, from customers to sales processes to the networks and the information and education, where we work with them on a day-to-day basis. And by that, we've been able to expand our team by a lot. And these partnerships, they're key when entering a market, I believe, because you can't do it on your own.
Thank you for sharing. I don't know, Esmeralda, Guillaume, you started writing, but I'm sure you can also shed more light on your answer as well.
Yeah, but it's about creating ecosystem, right, and communities, obviously. And you have, again, in Switzerland, there's a private and public sector. In the private sector, you have two main players. One of them is London Clinic, and the other one is Swiss Medical Network. And then for the public sector, every canton has his own public hospital. On our side, we are working with East London as they have chosen us to be their platform for the continuum of care, which is enable us then to tackle every clinics in Switzerland, and then to make the link with the home care. So that's one of the solutions. We are also in discussion with Swiss Medical Network for other projects. So as a start, working with the private company was easier to bring a new solution on the market. And obviously now the public organization, they want also then to work with us, as they see that it works in the real world and not only on a nice PowerPoint. So having then the adoption and the users on the field, having reference in specific area of Switzerland, Swiss German part, the French part, then makes the thing easier when you scale.
Perfect. Thank you very much. And Esmeralda, maybe for your perspective.
So for now, it's mostly hospitals with whom we work. But I would like to echo what Guillaume was saying. I don't know if evismo also, but working with pharma companies down the road, we see a lot of interest, and probably the same as for domo.health, for real world data. So when they're in drug development, they're interested in seeing how this will affect beyond the setting where they're actually measuring the impact. So this is definitely a route that we want to take, but not just for now, but yeah, in the coming months and next year as well.
Perfect. Thank you very much. One last question before we close the Q&A is regarding, there was also some question, and you started all writing about it as well, but maybe to shed a bit more light around the whole, how do you access and train the nurses, the doctors regarding the tools? Because as we were saying as well, is still in Switzerland a high resistance to digitalization, sometimes in different applications. And then as saying also, if everyone comes and wants you to, train on your device and so forth. So what's your approach here? Are you also going through bigger partners? What's kind of the activities you do? Especially you've all mentioned we're working quite highly with hospitals as well. So what's the approach there to bring the adoption rate higher? I don't know who wants to start.
I can just say that it's very important to involve nurses during product development in our case, because you could build something that is great and doctors don't have this really practical exposure. So they might like it very much, but if it doesn't have the buy-in of the people who are going to use it, in our case, and I believe also in the other two startups, they will also have touch points with nurses. It's really critical to involve them early on in the process.
Perfect, thank you.
Yeah, from a training and adoption, we do have webinars and online trainings. We have a lot of self-study documents, etc., for the Q&A. But when doctors or doctors' offices start working with us, in 95% of the cases, we do on-site trainings. Because exactly what Esmeralda is saying, nurses are the people who need to love us. And nurses love us when we come by, when we take the time to show it to them, and then they use us. And if nurses don't like working with the system, it will not be used in the doctor's office, even if doctors really want it, because they get all the nurses complaining about it, so they will stop using it. And nurses have become nurses because they love to work with people. So if you only do everything online while they're sitting at their reception desk and doctors are asking questions and patients are coming by and there's also flowers delivered and a lab coming by, you will not have the concentration. So even though it's a huge time-consuming thing to do, we strongly believe this personal contact initially really makes our top users and the assistants that love us, and in that sense, the adoption is a lot faster than if you do everything online.
Perfect. Thank you for sharing. And Guillaume, any last tips as well?
Yeah, so Bordeaux, we've been through all of this webinar and training already, but maybe one additional when you are like us, like 30 people, which is big and small at the same time, is the fact that whenever you grow and you scale, we have more and more new demands, specific demands of evolution of our software. And one of the challenge now is answering those demands. Shall we develop a new feature to sign more customer or make our customer happy, or shall we say no and then try to find feature which would then works for every customer? So that's a bit the challenge of software evolution. And shall we make customer pay for that or not? That kind of things. So to try to find a kind of a standardization of our software and features is one of the challenge as well.
Perfect. Thank you very much. Does each one of you just want to give one? Because I'm sure in the cohort today, there's also a lot of other maybe people with their own startups or trying to launch a startups or having the idea to do so, or going to be the future partners of startups. Do you have one tip you would want to share with the cohort before we close off this very interesting webinar? Yeah, just one short tip for the audience. I don't know who wants to start. I'll let that to you.
Maybe just co-creation. So meaning you should solve a pain that is big enough that the people will adopt what you do, and the co-creation. Maybe obviously business model is key, but yeah.
Perfect, thank you. Willemien, do you want to go next?
I think we mentioned most of them already, okay. But also here, I agree with the co-creation. Think in ecosystem, think in partnerships, and keep the patient in mind. What are we doing, and why are we doing it? Because I believe all of us who are in healthcare, we want to make patients' lives easier and better. And keep that in mind for all the activities you do. Don't only think about, there's loads of other things to think about, but as long as the patients are happy, your customers will be happy too. And that's what needs to be the driving force of whatever you bring into the healthcare system, I believe.
Yeah, I think that's very important as well. Really remembering who's the end user at the end of the day in your core mission that we all share. Esmeralda, one last tip.
Echoing what has been said, but also adding interoperability. So making sure that everything that we're designing is not in silos, because there's been a comment about having all these apps and we should not contribute to that. So we should, on our side, but also on the Swiss side, having more and more of a sort of a common platform for all these really great innovation to be fed on the same hub, to make it easier in general for doctors to adopt and patients to adopt our solutions.
Perfect. Thank you so much. We have still one question for everyone using the Mentimeter. So I'll quickly also share my screen, just wanting to see a bit what everyone's kind of taking away from the session today. Oops, sorry. I think I am, I'll reshare my screen. Oh, sorry. Thank you. I also put the password in the chat. And then we can then start looking at what are the answers that are coming through. I'll give everyone 1 minute to start to answer, and then we can have a quick look, and then we'll just do a short closing before we let you all to your different activities. So I'll start sharing my screen so we can start seeing live what is kind of happening on the screen. So perfect. So at the moment, we don't have any answers. So hopefully you did get some learnings from today.
Yes, but the thing is that the question is, which sector do you work in now? When
Oh, it didn't change. Sorry.
No.
It's supposed to have changed. Let me see.
Maybe,
It's okay. That's strange.
oh, yeah.
Is it
No,
on
we
the
should
right
just
one now?
skip. If we need to do skip, then to go to the next. So
Okay, because I see on my screen the second question. So I'm apologies for this. Let me just see if I can change it on my end.
I think it should work now, as
Okay.
some responses came in.
So we are seeing ecosystem thinking, co-creation, great interaction, innovation, working together. So really kind of echoing all the different messages that were shared by our three panelists. So really I think the most interesting aspect for me from today is seeing that already behind the doors, there's all these different exchanges happening between the different startups. Just having the great example today where Guillaume was saying that he's already in contact with both other companies to see how to include them in their platform. So I think that's really...
Sí, yo no sé cómo...
Sorry, I think someone was just talking. Yeah, so really seeing these synergies, really trying to build the bridges. So I think that's the most important thing that we're also trying to echo with Digital Switzerland, is really trying to shed light, because often the bigger problem is people don't exactly know who are the other solutions, what are they doing, where are they placed, and what's their focus, and how can these bridges be built. So really happy to see that it's already starting to happen. I'm sure that all three panelists will also be available through LinkedIn or through the email. I saw some already shared their email addresses. So if you also want to see how your solution can connect better to the other solutions, make sure to connect with them, because we'll only be able to push digitalization in the healthcare system in Switzerland, and also aim more towards preventive care when we all kind of co-work together and collaborate. So with this said, I really want to give a warm welcome to everyone for spending their lunch break with us, and especially warm welcomes for all your insights to Guillaume, Esmeralda, and Willemien. Thank you so much, and looking forward to seeing where your next steps will be.
Thank you very much.
thank you, everyone.
Thank you.